I looked at kind of what I did as a youth, and every summer I worked. After I was 16, I started working, and just staying busy, and then also, learning some skills around, just being on time, having responsibility, making your own money, things like that. That's been very important to us, and we're still actually working on that with the help of some of our staff as well as some community volunteers. But in addition to that, we've had uh, several things that are going on right now, mostly through community engagement, but then also some programming within the department. We started our behavioral health team this year, which addresses people that are experiencing mental illness and things like that. And then we've also looked at a lot of our policies and practices, and you may have some questions about that, but we can wait till you get to that.
I know that I remember I came to that press conference, I think, shortly after George Floyd's death. And you mentioned some, minor, wording changes in policies, that sort of thing.
Yeah.
And I just kind of wanted to know if there are other official changes that have been made in the past year as far as, policy goes, and if there are any more that are in the works right now.
Well, yeah, we made a lot of policy changes last year, more than 40 total. And initially in the press conference that you came to, we did change some wording. Many of the things that the nation was calling for, the community were calling for, we actually had policies in place that addressed those. But I wanted to make sure we clarified the language so that there was no question that we addressed those things. Like, for instance, just one of the policies that I mentioned last year was about chokeholds. Well, the thing was, with the police department, with GPD at least, we never authorized chokeholds, and we didn't teach them, but the policy didn't specifically spell out that you couldn't use it, because that's actually a deadly force move. So we made sure that language was clear in policy, and so that the public understood that that's not something that we do, and then also to clarify for our employees to make sure that they understood that that's something that we don't do, and we don't teach it anyway.
So as far as that use of force goes, I think you might have also mentioned then that officers are required to report if they witness use of force. Is that correct?
Yeah, so anytime we have a use of force, it has to be reported by the officer or by officers present. But in addition to that, we also implemented the duty to intervene. And so we had a general policy before, like, for instance, if anyone was violating a policy, if you as an employee witnessed it, you had an obligation to report it. So that would have covered, for instance, an excessive use of force. But we specifically put in the policy that you have a duty to intervene if you witness another officer using excessive force. So that made it very clear, not only for our employees, but clear for the public, that they had a duty to intervene if they witnessed an excessive use of force. So that was another policy that I changed at that time.
Do you think that with these changes, it's altered the behavior of your officers in any way? I mean, have there been less instances of use of force because of these changes?
No, I think we already had great policies in place and training, but I think it did clarify a lot of things. So for instance, if we did have an instance where someone was using excessive force, the officer present knows without a doubt that they have an obligation to put an end to it, either verbally or physically if they have to. So I think we already had great policies in place. One thing that I talk about too is how we recruit. And I think that you can have the best policies in the world. I may have probably said this in a press conference before, but you can have the best policies in the world, but if you don't have the right people in place, if they're not following your policies, then you don't have a lot. So we are also very intentional about how we recruit and how we vet those that will eventually wear this uniform.
And going off of that, something that I was kind of wondering, obviously the climate around law enforcement has been kind of tense over the past year, and even before that. Is it hard to find people who are wanting to do this job now?
Recruiting has been a challenge, not only in Greensboro but across the nation. So we have had to be very focused on trying to identify people that want to be police officers, but not only just identify people that want to be police officers, but actually have the ability and the background to be police officers. We have to make, and I'll say this, we have to make the profession attractive Again, because I do think that, some of the publicity around law enforcement certainly would make one think that this is not a good job. It is a very good job that gives you an opportunity to give back to the community. And when I say give back, it's enforcing laws, but it's just so much more than that.
Yeah.
And oftentimes we help people in ways that has nothing to do with actual law enforcement, and people depend on us to provide that service.
Yeah, so kind of backtracking back to the policy. I know you mentioned the behavioral health team. Is that what
Yes,
it's officially called?
Behavioral Health Response Team,
Okay.
or BHART is what we like to call it.
Okay.
Yeah.
And that's the mental health professionals that are going on calls, correct?
Yes, they actually ride with the officers and they're dispatched to mental health calls.
I just kind of wanted to know how that program's going. Obviously, it's new, and it kind of goes in line with situations like Floyd, like Marcus Smith in Greensboro. Just how has that changed the response?
So the program has been great thus far. It's been in place since January, and quite frankly, I hope that at some point maybe we're able to even expand it with additional staff. And right now we have one squad of officers that ride with a mental health clinician, and we've scheduled their hours around the times where we were able to identify we get the most mental health calls. One other step that we've taken, which hadn't been highly publicized, but we do have a number of officers that are crisis intervention trained, or it's called CIT.
Okay.
And so if a behavioral health team member is not available, our dispatch or Guilford Metro 911, they make an effort to dispatch someone who is CIT trained to a mental health call.
Okay.
So we're trying to do some different things to certainly improve that response. The Guilford County just opened up a new mental health center. They did the grand opening this past Saturday. We also think that's going to enhance our ability as a community to respond to mental health situations,
Yeah, I'm
to
sure
get people the care that they need.
Yeah, I'm sure that's a large percentage of your calls. Do you know how often on calls that they're utilize the team?
Well, I don't have the percentage broken
Yeah.
down, but what we did is, again, we looked at the peak times when we get the most mental health calls. And so they are typically Monday through Friday from about 7 a.m. until about 9 or 10 p.m. So we structured their hours around that time. So half the team comes in early, and then we have another team that comes in around noon and works till about 9 or 10 o'clock at night.
Okay.
Yeah.
All right. Well, another thing that I recall you mentioning last year was, the need to have mental health services for your officers. Obviously they witness some things that some people couldn't even imagine. So has that been realized? Has that been something that's been implemented here?
Yeah, so we've been working with City Human Resources Department, and that program should be up and running next month in July.
Okay.
So what that's going to do is it will give officers extended access to mental health care services at no additional cost. And that's something that we feel like is very important. We want to remove that stigma around mental health counseling. I think that, quite frankly, if you've got a problem, it's very healthy to be able to discuss it with a professional. The other thing that we did, and we've already implemented this, we started back in January. Every 5 years, we actually do a mental health reassessment of our officers. So we've already started that, and so far that's gone well. And we do a mental health assessment before we hire someone to make sure they're psychologically fit to be a police officer. So now every 5 years, we're making sure that they're still, mentally healthy, because, like you said, they are exposed to a lot of things. And actually, we're doing it after the first year of service, because that first year of service you see a lot of things that you've never seen before. And so, of course, we want to do a check-in after that first year of service to make sure everything is still okay, and make sure those officers are healthy as they're responding to calls.
Absolutely. Is that something that your officers were asking for?
Yeah, well, I'll tell you this. We had some discussions with some officers, and actually it was positively received throughout the department. And what I wanted to do, not only with